Of discussion is axillary lymph nodes. Why axillary lymph node is so important? Well, why axillary lymph node is so important? Especially in case of female. Why? Because of the breast carcinoma. I have already told you that breast carcinoma mainly spreads through lymphatics. So you must have sound knowledge about the lymphatic system of the breast. Now axillary lymph node, here you see actually lymph nodes, you will get lymph node along the blood vessels, especially the veins. Here you see the lymph node, axillary lymph node is divided into many groups. Number one, here you see it is actually deltopectoral group. It is deltopectoral group. Here lies deltopectoral group of lymph node. This deltopectoral group of lymph nodes, actually here the lymph vessels on the lateral aspect of the upper limb, along the course of the cephalic vein. These lymph vessels actually passes along the cephalic vein, and they will drain into the deltopectoral group of lymph node. Sometimes if you have infection, suppose there is infection on the arm lateral aspect, that group of lymph node will be enlarged. And in case of carcinoma also, if at that part carcinoma develops, that carcinoma will spread through these lymph vessels and will first involve the deltopectoral group of lymph node. So deltopectoral group of lymph node, one group. Now another group, that is anterior group of lymph node. This is the anterior group of lymph node. Here you see this vessel which is passing along the inferior margin of this muscle. The name of this muscle is pectoralis minor. Pectoralis minor. And you already have seen that along the lower margin of the pectoralis minor, the vessel which is running towards the chest wall, that is lateral thoracic artery. Lateral thoracic vein. So along the lateral thoracic vein, this anterior group of lymph node lies. Now here you see this artery is subscapular artery, and you know subscapular artery lies on the posterior wall of the axilla. So here the lymph node which lies along the subscapular artery, that is called posterior group of lymph node, the subscapular artery. Subscapular artery. Now another group, that is lateral group, that lies along the axillary vein. This is the lateral group of artery, lies along the axillary vein. Here you see another group, apical group, that also lies along the axillary vein, and here it lies close to the first rib. So here it lies close to the first rib along the axillary vein. This is the central group of lymph node. Central group of lymph node also lies along the axillary vein. This is actually axillary vein. This is axillary vein. Yeah. This is axillary vein. This central group lies in the floor of the axilla, there lies the central group of lymph node. It is also along the axillary vein. And one important structure passed through this central group of lymph node, that is costobrachial, intercostobrachial nerve. Intercostobrachial nerve. It is intercostal nerve which is passing through this lymph node and join the medial cutaneous nerve of the arm. এটা মনে রাখবি। Intercostobrachial nerve, important ID. If it is present on the cadaver, you may be asked, what is this nerve? It is coming from the lateral chest wall and passing along the floor of the axilla and making connection with the medial cutaneous nerve of the arm. And through this route it supplies the posteromedial part of the upper part of the posteromedial aspect of the arm. Here it supplies. So if this nerve is irritated, suppose due to the cancer of the breast, the lymph node may be enlarged. If lymph node is involved and central group is involved and it will irritate, then pain will be referred to here. Patient may complain of pain along the posteromedial aspect of the arm. হঠাৎ করে ধর একটা পেশেন্ট এসে বলছে, একটা ফিমেল পেশেন্ট এসে বলছে, তখন তুই কী করবি? তখন এখানে কেন পেন হচ্ছে? তাহলে তুই অ্যাটলিস্ট ইউ উইল প্যালপেট দ্য ব্রেস্ট টু সি whether there is any growth. Now the area which it, after describing the lymph node, position of the lymph node, you have to know which area it drains, and from which area of lymph vessels actually coming to this lymph node. Now deltopectoral groove, I have already told you, lateral aspect of the arm, forearm and arm, that is the deltopectoral groove. And posterior lymph node. Posterior groove lymph node it drains the posterior wall of the chest up to the iliac crest. এখানে একটা বোনস আছে, তার নাম হচ্ছে হিপ বোন, তার ওটাকে বলে ইলিয়াক ক্রেস্ট। তাহলে posterior wall of the chest up to the iliac crest, পেছনের পুরোটাই। Now anterior groove lymph node, it drains the anterior chest wall as well as abdomen up to the umbilicus. তাহলে umbilicusের উপর পর্যন্ত, if there is any infection, that will be drained into the anterior groove of lymph node. এখানে ফোড়া হলে দেখবি এই জায়গায় lymph node ফুলে গেছে, বুঝতে পেরেছিস? above the umbilicus. So this is the anterior groove of lymph nodes. And if there is any infection of the upper limb, especially the medial aspect, then it will also drain into the lateral groove of lymph node. This is the lateral groove of lymph node. Here actually it drains the upper limb except the area along the adjoining area along the cephalic vein. Cephalic vein area বাদ দিয়ে rest of the hand supplied by the lateral groove. আর ওই lateral aspect হচ্ছে deltopectoral groove. Clear হয়েছে রে? Now come to the how these lymph vessels পেছনে posterior group. Now this lymph node, what happens? They will first drain into the central. মানে lateral group, posterior group, anterior group, they will first drain into the central group. From the central group it will drain into the apical group. From the apical group it will go to the apical group will form. From apical group will form the subclavian lymph vessels. That subclavian lymph vessels will go and will meet the jugular lymph vessels. And on the left side it will drain into the thoracic duct, and on the right side it will drain into the right lymphatic duct. মনে থাকবে, পাঁচটা মনে থাকবে। ফার্স্ট সবগুলো আর কি, anterior, lateral, posterior, they are draining from the skin, and from there efferent lymph vessel will go to the central group. From the central group another efferent will go to the apical group. From the apical group it will go into the neck. Here it will meet the jugular lymph vessels, and this subclavian lymph vessel and jugular lymph vessels, they will meet and they will drain into the final যেটা লিফট ট্রাঙ্ক আছে, on the left side thoracic duct and the right side right lymphatic duct. This is the pathway of the lymph vessels. Anterior group drains which area of the body? It drains the anterior chest wall and anterior abdominal wall up to the umbilicus. From there, the afferent lymph vessels will go to the anterior group. From here, your efferent lymph duct will go to the central. Now, posterior group. It is the posterior wall of the axilla as well as posterior chest wall up to the iliac crest. This is the afferent vessel will come from there. Now, efferent will go to the central. This is the lateral group. Lateral group drains whole of the upper limb except the lateral aspect, and it will drain into the central group. Right? Now, all this will go to the apical group. From central the efferent will go to the apical. From apical, it will go as subclavian lymph vessels. It will go as subclavian lymph vessels. These subclavian lymph vessels will join with the jugular lymph vessels. Jugular lymph vessel actually draining the head neck. head neck. Now, after joining, this joint duct will open into the thoracic duct on the left side and right lymphatic duct on the right side. Right? So, these are the lymphatics of the axillary lymphatics. Now, come to the breast. Now, sometimes question may come, describe the lymphatics of the breast. This is the lymph node. This is the para-sternal lymph node. Para-sternal is by the side of the sternum. It lies along the internal thoracic artery. This is the anterior group lymph node. I have already discussed anterior group here lies. Anterior group here lies. Anterior group here lies along the left thoracic. Along which vein? Lateral thoracic vein. Along the lower margin of the pectoralis minor. Along the lower margin of the pectoralis minor runs the lateral thoracic vein. Along this vein lies the anterior group lymph nodes. Right. Now the lymphatic of the breast is divided into two sets: superficial set and deep set. Superficial lymph nodes, superficial lymph vessels and deep lymph vessels. Superficial lymph vessels where it drains. The whole of the superficial lymph vessel except the areola and nipple. Areola and nipple. Maximum lymph vessel drain into the anterior group lymph nodes. The superficial lymph vessels of the breast except the areola and nipple mainly drains into the anterior group of lymph nodes. From the medial aspect, a few lymph vessels go to the para-sternal lymph node. Tale maximum asche anterior group, some a little goes to the para-sternal lymph node. Para-sternal lymph node. From there, sometimes it also involves the other side of the para-sternal lymph node. Eta right side dhar, the left side also sometimes it may involve on the ekhane para-sternal lymph node dhar ashe. It may also involve the right side also. So cancer from one breast may go to the opposite side through this path, spread through this path. Now, from the upper part, it will go to the supraclavicular lymph node and also infraclavicular lymph node. So, it is the supraclavicular lymph node which will pass. Now, from the medial aspect, sometimes lymph vessels may come and it may pierce the anterior abdominal wall, rectus sheath. It may pierce rectus sheath and may join with the subperitoneal lymph plexus. And from this lymph plexus, it may involve the abdominal lymph node, and from there abdominal lymph node may be involved. Among the abdominal lymph node there is hepatic lymph node, liver. So from breast cancer may spread to the liver also. From which route? After piercing the rectus sheath, it will enter into the abdomen. There it will make connection with the subperitoneal lymph plexus, and that subperitoneal lymph plexus will provide the path to the abdominal lymph node. Sometimes some lymph vessels, some carcinoma cells may drop within the peritoneal cavity. লুজ হয়ে যায় যখন ক্যান্সার সেলগুলো লুজ হয়ে যায় অনেক সময় ড্রপ করে যায় আর কি ড্রপ করে ইট মে ফল উইদিন দ্য peritoneal cavity. From that peritoneal cavity it will may involve the organ of the pelvis, pelvic organ. That means here lies the uterus and কি বলে তোর ovary. So it may also involve the ovary. That spread is called transcoelomic path. That spread is called transcoelomic path. And the tumor from breast, if ovary is involved through transcoelomic path, that is called Krukenberg tumor. Krukenberg tumor. If you are asked, may breast cancer may spread to ovary? So you will yes. How? Then you have to describe this path. It will enter into the abdomen. From abdomen, some cancer cells will drop within the peritoneal cavity, and through this peritoneal cavity, it may involve the ovary or other any pelvic organ. This type of spread is known as transcoelomic spread, and if ovary is involved through this path, then it is called Krukenberg tumor. That is superficial. Now deeper. I mean, it is superficial lymph vessels, deep lymph vessels. Deep lymph vessels, they also spread like superficial. Here the areola means the area around the nipple. This areola form a plexus just deep to the areola. The lymph vessel form a plexus just deep to the areola. That is called subareolar plexus of Sappe. Sub here. Just deep to it, lymph vessels will form a plexus that is called subareolar plexus of Sappe. Subareolar plexus of Sappe. Subareolar plexus of Sappe. দুটো পি হবে না একটি পি হবে দেখে নিবি ডবল পি or single P. Now this plexus joins the plexus which are draining the parenchyma of the breast. আগে যেটা ডেসক্রাইব করলাম skin, superficial lymph vessels drain the skin, and deep lymph plexus will drain the parenchyma of the breast tissue along with the areola. Now how they will spread. They also their major part will come to the anterior group. And that is 75%. That is 75% will come to the anterior group. 20% will go to the parasternal group. From the parenchyma of the breast, 20% will go to the parasternal group. তাহলে থাকলো আর 5%. 5% will go to the where it will go? It will go to the बोलो what? Supraclavicular part. Supraclavicular is actually it is not supraclavicular. It will be the intercostal. Intercostal means between the two ribs. Between the two ribs, there are some on the posterior aspect of the ribs. There are some lymph nodes that are called intercostal lymph node. From that 5% will go to the intercostal lymph node. 5%, right? Now here also Here also the spread, the lymph vessel ultimately will pass through the, where it will go, ultimately it will go into the, on the right side, on the right side and the left side thoracic duct and left side right side right lymphatic duct. Right. Sometimes that superficial lymph node which is draining the breast, sometimes they may be blocked by the cancer cell. Then what will happen? If superficial lymph node is blocked by the cancer cells, the lymph will not be able to come. So lymph will accumulate and there will be edema. Because of the edema, the breast will be enlarged and the sweat glands, where sweat glands is situated, that part actually edema will not spread there. So there will be some dimpling there. Side area will be swollen, but where the sweat glands are attached, there will be no edema. So there will be the condition which will appear, that will look like the orange peel. Orange দেখেছিস তো অরেঞ্জের গা কেমন থাকে, খানটা ঢুকানো খানটা এরকম অরেঞ্জ পিল, এটা মানে সেটা যদি দেখি যে একটা অরেঞ্জ পিল অ্যাপিয়ারেন্স হয়ে গেছে, তাহলে ইউ উইল সাসপেক্ট দ্যাট দিস লেডি ইজ সাফারিং ফ্রম ব্রেস্ট কার্সিনোমা। এটাকে আরেকটা নাম আছে পিউডি অরেঞ্জ, এটার একটা নাম বলে, যদি নাম মনে থাকে বলবি অরেঞ্জ পিল লাইক অ্যাপিয়ারেন্স। Why it is? Because of the lymphedema. It is because of the why lymphedema? Because lymph vessel has been blocked by the cancer cells. বুঝতে পারলি? আচ্ছা, generally it is a hypothetical idea, the lymph node which will be first involved, that is called sentinel lymph node. Sentinel. That means the first lymph node which will be involved in carcinoma breast. Generally, that sentinel lymph node is generally anterior group of lymph nodes. First of all, anterior group first involved. হ্যাঁ, তো sentinel lymph node হলে তাহলে আমরা কী করবো, আমরা যখনই দেখবো ব্রেস্টের কিছু হয়েছে আর কি, ইজ দের এনি গ্রোথ, ফার্স্ট উই উইল কনসিডার দ্য lymph node biopsy of the anterior group. Anterior group থেকে lymph node দিয়ে উইল send for biopsy. Right? তাহলে এই গেল তোর কি বলে, তোর লিম্ফ্যাটিক ড্রেনেজ অফ দ্য ব্রেস্ট। এটা খুবই ইম্পর্টেন্ট, অ্যানাটমিতে ইম্পর্টেন্ট। when you will go to the surgery, again সার্জারিতে ইম্পর্টেন্ট। আচ্ছা, here again there are clinical classification আছে একটা, সেটা হচ্ছে তোর ক্লিনিক্যাল ক্লাসিফিকেশন আছে, তাতে আবার ওই ছবিটা বের করতে হবে, আগের ছবি প্রিভিয়াস। Stage 1, Stage 2 and Stage 3. Clinically, lymph node classified করা আছে Stage 1, Stage 2 and Stage 3. Stage 1, when the lymph node involvement lies below the pectoralis minor. The lymph node which lies below the pectoralis minor, when they will be involved, it is Stage 1. Stage 2, when the lymph node in front of the pectoralis minor and deep to the pectoralis minor, that is sometimes lymph node lies deep to the pectoralis minor, that is called this is the interpectoral, between two pectoral, interpectoral lymph node and the lymph node which is present in front of the pectoralis minor, that is Stage 2. And above the pectoralis minor, that is apical group of lymph nodes, এপিক্যাল গ্রুপ, এপিক্যাল গ্রুপ। তাহলে স্টেজ টুতে হচ্ছে সেন্ট্রাল, স্টেজ টুতে হচ্ছে সেন্ট্রাল প্লাস ইন্টার pectoral, central and interpectoral stage 2, and lateral, anterior and posterior stage 1, আর apical is stage 3. In this way there is some classification. So these are the classification of the lymphatics of the breast, right? Acha, কালকে yesterday so কমপ্লিট হয়নি, yesterday তো কমপ্লিট করা যায়নি। yesterday আমরা স্টার্ট করেছিলাম তোর কি বলে আর্চ, সুপারফিশিয়াল পামার আর্চ অ্যান্ড ডিপ পামার আর্চ, এটা পড়ে নিবি কিন্তু। সামটাইমস উই মে নট কমপ্লিট বাট ইউ উইল স্টাডি ফুল, বাড়ি থেকে পড়বি ওগুলো, কেন ওগুলো আসে খুব। আর একটা আজকে একটা ডিসকাস করি, সেটা হচ্ছে ব্লাড ভেসেলস অ্যারাউন্ড দ্য এলবো জয়েন্ট, ব্লাড ভেসেলস অ্যারাউন্ড দ্য এলবো জয়েন্ট। সামটাইমস there are some anastomosis around the joint. It should be studied, because sometimes if there is any blockage, suppose here brachial artery was blocked. If brachial artery was blocked, then how this part, distal part, will get blood supply through this anastomotic channel. So you have to know the anastomosis around the joint, because joint always you are flexing, extension, flexion, so there may be kinking of the artery, so in that case there may be blockage, and if there is any blockage, then how the other parts, mainly distal part, will get blood supply through this anastomotic channel. Now in case of elbow joint, you have to know the anastomosis, what anastomosis lies here. Number one, you have to consider in front of the anastomosis, in front of the medial epicondyle and in front of the lateral epicondyle, in front of the medial epicondyle and in front of the lateral epicondyle, right? In front of the lateral epicondyle, lateral side কোন আর্টারি থাকে? radial or ulnar? lateral side radial, medial side ulnar. Now when we are talking about the radial side, suppose this is the lateral epicondyle, this is lateral epicondyle. Here the artery will come from the branch of the arteria profunda femoris. Arteria profunda femoris. Suppose this is the arteria profunda femoris. Arteria profunda femoris will give radial, superior radial collateral, superior radial collateral. Superior radial collateral, and another branch will, it is coming from above, another branch will go from below. Below means below will get the Radial artery. Radial artery will give a branch like this. When one branch is going against the arterial flow, that is called recurrent branch. এই ব্রাঞ্চগুলো যেগুলো আবার উল্টো দিকে যাবে, অপোজিট ডিরেকশন, দ্যাট ইজ কল্ড রেকারেন্ট ব্রাঞ্চ। তাহলে এটা কি বলবো? রেডিয়াল রেকারেন্ট ব্রাঞ্চ। রেডিয়াল রেকারেন্ট ব্রাঞ্চ অ্যান্ড সুপিরিয়র কোল্যাটারাল ব্রাঞ্চ অফ দ্য রেডিয়াল আর্টারি। এটা এমনি জেনে রাখ, নিজে নিজে পড়ে নিবে আর কি, আমি আইডিয়াটা দিয়ে দিচ্ছি। এবার এটা অ্যান্টিরিয়র, পোস্টেরিয়র অ্যাসপেক্ট। পোস্টেরিয়র অ্যাসপেক্টে আর একটা ব্রাঞ্চ দেবে কোল্যাটারাল, দ্যাট ইজ মিডিল কোল্যাটারাল। এটা সুপিরিয়র কোল্যাটারাল ছিল, এটা মিডিল কোল্যাটারাল। ইট উইল গো বিহাইন্ড অ্যান্ড অ্যানাদার আর্টারি দ্যাট ইজ কল when the brachial artery is divided into two terminal branch, one is radial, one is ulnar. Ulnar will again give a branch that is called interosseous, common interosseous. Common interosseous will be again divided into anterior and posterior interosseous. From that posterior interosseous, one recurrent branch will go and will anastomosis with the middle collateral branch of the arteria profunda, and that is lie behind the lateral epicondyle. একটা গেল। এবার I medial epicondyle. Here branch is coming from above, that is from the brachial artery, upper collateral, and anterior recurrent, upper collateral from the brachial artery, and anterior recurrent from the ulnar artery. It lies in front of the medial epicondyle. Another branch, inferior, ভুলে গেল, upper collateral যেটা, that will lies behind the medial epicondyle. Behind the medial epicondyle. Our lower collateral lies in front of the medial epicondyle. Upper one piche and lower one in front. Right? Anterior recurrent will come in front and posterior ulnar recurrent will go behind. In this way, there will be an anastomosis around the elbow joint. এটা হয়ে গেল তোর এজন্য। আর একটা ইম্পর্টেন্ট যেটা তোরা করবি আর কি, হোয়াট উইল ইউ ডু, দ্য মেজর থ্রি নার্ভস, মিডিয়ান, রেডিয়াল, ulnar, you will see the course in the dissection body, you will see the course and you will study at home. Sometimes you may be given one major nerve, sometimes one major nerve may come as a broad question. Sometimes some clinical problems will be given. Suppose one clinical problem is Saturday night palsy. What is called Saturday night palsy? Really, after drinking wine, sometimes কি করে পেশেন্ট ধর চেয়ারে ঘুমিয়ে গেছে, হাতটা পেছন দিকে এরকম হবে, that will press the posterior aspect of the arm, and here lies the radial groove. So radial nerve will be involved, and the patient in the morning he or she will notice that he cannot walk properly. There has been some paralysis. That is called Saturday night palsy. So you will be given a problem like this. Then will be which nerve was involved, where it was involved, what effect will it produce, describe the path of this nerve. In this way, question will come. So you must see the course of this nerve, then it will be easy for you to memorize. Otherwise, only reading book, you will not be able to memorize it. You will see the dead body, and from on which muscles it is passing, and which muscle it is piercing, where it is giving different branches, you should study like this. Then you will be able to memorize it. right? So these are the, it is not possible to cover all these things. Some important topic will be discussed here in the lecture theatre, but you have to memorize all this. And if you start right now from the previous questions, then you will be in a better position before exam. তাহলে এটাই আজকে